Assalamu alaikum, Dr. Shahid Mahmood here. So in this video we will discuss a case where a toddler was presented to us by the parents with a complaint of delayed achieving of motor milestone as well as deformity of the limbs, mainly in the lower limb that was seen. On physical examination, the positive sign in this picture, you can see that the patient is having wrist widening as well as a widening at the ankle joint and the bowing of legs. So these were the physical important finding that I've seen in the video. Considering the deformities, wrist widening, we went for the x-rays of the wrist joint, and you can see that x-ray is showing typical signs of ricket. So what are the typical signs of ricket? Their signs are cupping, wrist widening, fraying, and the generalized osteopenia. So I will discuss what are these signs. One is the wrist widening. The wrist widening that can be seen on physical examination can also be confirmed on the radiologically, that the bone will be widened at the metaphysis. Second is cupping. Normally the metaphyseal end are usually convex outward, but in cases of ricket, due to osteopenia and due to poor bone formation, these are concave. So concavity is called as cupping. Next is fraying. If you normally see the x-ray of the wrist joint, then the margin will be very clear cut margin. But in case of ricket, there will be irregularities, minor irregularities. These are called as fraying. And next is the osteopenia. So you can see the density of bone. The normal bone's density, if you compare the density of this patient with the normal patient, then the density is markedly reduced. You can see this more aeration here, and spicule bone is seen in the form of spicules. So that is osteopenia. So we have sent in this case, considering the rickets, and most common cause of ricket is the nutritional ricket, that is due to the vitamin D deficiency. It can be multiple causes, from decreased store in mother to not supplementing vitamin D to poor exposure to sunlight, and the most common is the vitamin D deficiency that is of nutritional origin. So we have sent the panel that includes calcium, phosphorus, alkaline phosphatase, PTH, and 25 hydroxy vitamin D level. So an important question is that what vitamin D level you will advise here. So that is 25 hydroxy vitamin D. Because that is important source, that is the reservoir form of vitamin D in which the vitamin D is stored. The active form is 125 hydroxy vitamin D, but that levels can be fluctuating, and even if the vitamin 25 hydroxy vitamin D stores are not properly present in the body, body can activate the remaining 25 hydroxy and can have adequate level of 125 hydroxy. So 25 hydroxy is the test of choice. So in this case, we will give after labs a STOS therapy. STOS therapy can be given in the two form. One is the straight dose, and other is that we will give the dosage for the period of 3 months. Straight dose is 3 to 6 lakh international unit of vitamin D that are given over the in a single day in 2 to 3 doses. We divide the dose, like if 2 lakh, then we can give 2 doses of 2 lakh injection orally. Some cases IM, and if we want to give a prolonged period like 3 months, then we will give 2000 international unit per day. The advantage of single dose is that you don't need the patient to come again, and compliance is not issue. But the disadvantage is toxicity, although safe, but can have toxicity. The other regimen, that is for the 3 month 2000 international units per day, the advantage is that lesser chances of toxicity. Again, disadvantage is that if patient is having poor compliance, then issues can be there. How will you confirm that your therapy is working? So you follow the patient after one month, and you will advise the x-ray. The line of calcification will be formed at the ends that shows that patient is having recovery phase. If still there is no line of calcification, you have to repeat the dose, and you can extend your workup for the other causes of ricket, vitamin D resistant ricket, or other cases, but you can repeat the dose at that time. And the important question is that radiological improvement is seen the first in the rickets. Another very important question, rickets, that is asked in MCU, and that how you will diagnose rickets. How will rickets diagnose? How that is that ricket is diagnosed by the X-ray. So X-ray is the test of choice for diagnostic rickets. For the etiology, you can go for the vitamin D level, you can go for the RTA workup, you can go for the CKD workup, and other things. But diagnosis of ricket is radiological. These are something that I want to share with you. If you like the video, share it with others. Thanks.